Hi and welcome back to another video of Medic Notes. This video is on guidelines on antibiotic prophylaxis in labor. I will cover on these few topics, including antibiotics given in Caesarean section, chorioamnionitis, preterm labor, PROM or PPROM, 3rd and 4th degree perineal tear, instrumental delivery, manual removal of placenta, ragged membrane, prophylaxis against infective endocarditis, and also other clinical conditions. In Caesarean section, a single dose of IV broad-spectrum antibiotics, IV cefazolin 2 grams should be given. The preferred antibiotic may change from time to time. The timing of administration should be within 60 minutes before the skin incision. If the woman is already on antibiotics, then the most recent dose should have been administered within 60 minutes prior to the skin incision. Women who are obese may require a weight-adjusted dose. In complicated C-section with massive PPH, a second dose of IV cefazolin 1 gram can be given after 4 hours. Longer duration of antibiotics can be considered on a case-by-case basis. Next, for chorioamnionitis, antibiotics of choice should be IV cefuroxime 1.5 grams stat followed by 750 mg TDS. And IV metronidazole 500 mg stat and TDS. Change to oral cefuroxime 500 mg BD and oral metronidazole 400 mg TDS post-delivery if there is no sign of worsening infection. Antibiotics should be continued for a total duration of 7 days. In preterm labor, antibiotics should be started to cover for group B streptococcus, as the rate of GBS infection in preterm labor is much higher. Either IV ampicillin 2 grams stat and 1 gram 4 hourly until delivery. Or IV benzyl penicillin 3 grams stat and 1.5 grams 4 hourly until delivery. In cases of PROM, antibiotics are started after 12 hours of leaking liquor if the woman is still undelivered. Give IV ampicillin 2 grams stat and 1 gram 4 hourly until delivery. If allergic to penicillin, give IV clindamycin 900 mg stat then 8 hourly. In PPROM, start on tablet erythromycin ethyl succinate 400 mg BD for 10 days. And consider delivery if the woman is still leaking after 34 weeks. Intrapartum, give IV ampicillin 2 grams stat then 1 gram 4 hourly until delivery. For cases of 3rd and 4th degree perineal tears, start IV cefuroxime 750 mg TDS and IV metronidazole 500 mg TDS prior to surgical repair. And convert to oral cefuroxime 250 mg BD and oral metronidazole 400 mg TDS once the woman is tolerating well orally. Complete at least 7 days of antibiotics. In instrumental deliveries, a single dose of Augmentin 1.2 grams should be given within 1 hour of delivery in women without any contraindications. IV clindamycin 900 mg stat can be given instead in women with penicillin allergy. Next, for cases of manual removal of placenta, give a single prophylactic dose of IV cefuroxime 750 mg and IV metronidazole 500 mg. Followed by oral cefuroxime 250 mg BD and tablet metronidazole 400 mg TDS for 7 days. For delivery with ragged membranes, prophylactic antibiotics are not routinely required. The woman should be advised regarding the slight risk of endometritis. The women should be counseled about the signs and symptoms of endometritis. For prophylaxis against infective endocarditis, give IV ampicillin 2 mg and IV gentamicin 1.5 mg per kilogram stat within 60 minutes to C-section, or at the onset of ruptured membranes. Give a second dose 6 hours after the first dose. If a woman is allergic to penicillin or if there is enterococcus concern, give IV vancomycin 1 gram over 1 hour, plus IV gentamicin 80 mg stat, and a second dose 6 hours later. For other clinical conditions, there is no role for antibiotics in an event of an emergency or elective cervical cerclage. Consider prophylactic antibiotics with tablet cephalexin 250 mg OD for women with recurrent urinary tract infection or pyelonephritis. That's all for this video. Thank you.